Welcome to another Grant County Community Update. I'm Director of Communications for WSOT TV and Sunnycrest Baptist Church, Angela Stepp. And in a moment, Grant County leadership will be sharing important information pertaining to the COVID-19 outbreak. This community update will be rebroadcast today here on WSOT TV at 5:30 p.m. and again at 10:30 p.m. Additionally, it will be re-aired on Sunday, April the 26th at 10 a.m. and then again at 5:30 p.m. It will also be made available for online distribution and throughout all of our local media outlets. Joining us today will be Bob Jackson, Grant County EMA Director, Mark Bardsley, Grant County Commissioner, Indiana District 31 Representative Ann Vermilion, Dr. Brad Lindsay, Superintendent of Marion Community Schools, Alicia Hazelwood of the United Way, Sarah Evans from Marion General Hospital, Dr. David Moore from the Grant County Health Department, and Aaron Grindstaff, Regional Director of Operations for TLC Management. Joining us first will be Bob Jackson from the Grant County EMA.
Thank you, Angela. Good afternoon, Grant County. We'll bring you up to speed a little bit on what we've been doing at the Grant County Emergency Operations Center. We are on our 42nd operational period. In each one of those periods, we assess what has happened the day before, and I think we've been through this several times now. So we are still continuing the same mode of operation. Based on what has happened the previous day, we plan our next moves. So with that, we've maintained situational awareness with our District 6 partners, along with our state and federal Department of Homeland Security partners as well. So we get feedback and information from many different sources that helps us to plan our next steps and what we can expect here in Grant County. Preparedness, we're using this time, really we've been in a bit of a lull, so we're using this time to build our preparedness, build our PPE for our first responders. We are still struggling a little bit with some PPE there. However, we have developed different means to protect our first responders, so if they do show up at an incident, you'll see them dressed a little bit differently than what they typically would be. Firefighters will be in maybe full gear, depending on the situation. Police officers will be wearing masks and gloves, a little different than what you typically would see them respond to. But there again, that is to protect them and also to protect the public as well. So we'll continue to do that for as long as necessary. The next step we're doing, we're still trying to look long-term, do some planning for reopening the county, which I'm sure the commissioner will speak to as well. There again, we get a lot of direction from the state. The governor spoke this week several times about what it takes to do that and be smart about how we reopen. We just can't fling the doors open and go back to business as usual. I'm not sure we will ever get back to business as it was before. So we're looking at things now that we can do to start to slowly reopen, get back to where we were. And a couple ways to do that. You know, we want to make sure that we can safely protect the public that are coming into any establishments, protect those workers, provide a safe workplace for them as well. And that may include limiting the number of people that used to be in a restaurant. Maybe that will be fewer. I'm not exactly sure how that will look, but as we move forward, we are looking for direction from the state. We'll be looking at different businesses within the county, looking for best practices, and we will tweak them as we go. Things may have to change. There again, we will reassess daily. So if changes need to happen, we will bring them about as we need to. So hopefully we can begin to get back on track fairly soon. And with that, I think I'm done, and we'll turn that over to Commissioner Bardsley.
Good afternoon, and thank you again for allowing us to come in and share with you updates on what's going on with regard to the coronavirus and Grant County in general. Most recently, the governor's executive order asked us to continue to stay at home through May 1st. And of course, this is quite still restrictive. The order continues to restrict travel to essential travel only and essential work only. That would be regarded as foods, as medicines, as those things for life-sustaining issues. But I cannot express my gratitude enough to our community for your self-discipline and observing this stay-at-home order. This is the thing that is helping us to stop the spread of this virus, and appreciate it so much. I've reminded you a few times, and even with our most recent statistics today, Grant County is showing a 5% mortality rate on those who have been tested positive for coronavirus. And according to statistics, I think you'll see that this is 5 times higher than regular influenza. And so this is a nasty virus that we are fighting, and if it weren't for what we were doing, our healthcare system would be flooded, and we would be losing more people than what we are today. So thank you for your continued sheltering in place and doing those things to avoid unnecessary contact. I also want to say thank you for your continued support for the food service industry here in our county. When it's possible, go ahead, drive through, do the carryout, do the takeout, and support your local businesses as best we can. Please always, if you do have to be out, continue to use that physical distancing, making sure that you are washing your hands, using proper hygiene, because the more we do that, again, the more we kill the potential for germs on our hands. We're not making that spread, and that helps us. I wanted to kind of give you just a quick outline of what the opening up America again means. And this is really a system of checks and balances for every community at the state level as well as the local level to get us back to work, to utilize proper safeguards, and to keep our communities moving forward. And so you probably heard the president or news commentators talking about these phases that we will need to be going through, phase 1 through phase 3. But prior to that, there is really a preparatory staging, or a gating, as they call it, for phase 1. That means that the community needs to be seeing a downward trend in not only positive cases, but in deaths. And so as we have that struggle going on right now, we continue to watch our numbers. We continue to monitor all that's going on. And that's what the state's doing right now, is looking for that downward trend so that the state can move as many communities back into that phase 1 as possible. Part of this staging prior to phase 1 includes not only seeing the numbers come down, but the ability to have testing as needed on demand to take care of those needs. Making sure that our healthcare system has the capacity to receive individuals that are sick. And then when it comes to the business, not only will there have to be strategies and protocols developed, but physical distancings within business, protective equipment for the employees. We're talking about that staging also requires temperature checks, sanitation, disinfecting of common and high-trafficked areas. And so all of our businesses are trying to figure out how that they can do these things in preparation to get to phase 1. Once we get to phase 1, we would say that all vulnerable individuals still need to continue to shelter in place. And I'll just who are those vulnerable individuals? The federal government right now is identifying elderly individuals as vulnerable, individuals with serious underlying health conditions, including high blood pressure, chronic lung disease, diabetes, asthma, those with immune systems that are compromised, such as those that are dealing with chemotherapy and cancer treatments. Those are individuals that we would consider vulnerable at this time. With that in mind, with phase 1, people still sheltering in place with those conditions, when in public, we're talking about people using that CDC required at least 6 feet as an appropriate measure. If you have to be out in larger group areas, masks and gloves will be a part of that protocol. And businesses will be returning to work in phases, bringing in part of their workforce, developing, making sure that they are taking care of them, bringing in more of the workforce at another time. Phase 2, once we get to that, we have to actually go back to the staging and make sure that all of our statistics are still going down, all those protocols are in place before we actually move into Phase 2 and Phase 3. It's kind of a cycle that we have to go through. Phase 2 would again be all vulnerable individuals continuing to shelter in place. Non-essential travel can resume when we finally get to Phase 2. We'll have a much more opening of things, but then the physical distancing still will be required protocol as well. When we get to Phase 2, according to what the government is doing and what the governor is working with, daycares and schools will have that opportunity to reopen. Large venues can operate again with the appropriate distancing and materials that they need. Phase 3 will be that gradual program of reentering into our normal social structure. Again, those vulnerable individuals will be asked to minimize travel and to take care of themselves with masks or other protocol as needed. I know that we have been doing this for 30 to 40 days. Some of us have been shut up in our homes, locked away from interaction. And so I want to talk to you just a second before we move on about our positive mental attitude. During this time, there are a lot of people that are really desperate for attention, affection, discussion. And so I want to encourage you, if you know folks that are by themselves, call them, text them, interact with them as best you possibly can, and encourage one another as we go through this very difficult time. As we work on that positive mental attitude, I've been thinking about that concept, again, from Scripture. Rejoice in the Lord always, and again I say rejoice. And that doesn't mean just in the good times. It means in the bad times as well. And we can rejoice because somebody gives us a call and say, hey, how you doing? What's going on in your life? How can I encourage you? How can I help you? How can I even pray for you right now? We continue to work through this together, and together we're going to get to the other side, and we're going to get back to our normal. So thank you for the opportunity. If you do have questions, feel free to call the Commissioner's office or check our website, and we have plenty of links to different resources. Thank you very much.
Thank you, Commissioner Bardsley. And next joining us will be Indiana District 31 Representative Ann Vermilion. Welcome.
Thank you. I just really appreciate the time and the opportunity to come and speak with you. We know that these are very challenging times, and we're all trying to learn and adapt this new normal, but it's a temporary normal, and we're all in this together. This is a new phrase that we have for Grant County, and I absolutely love it. It means that you're not alone, and that's really important during this epidemic. Our state continues to work to support Hoosiers during this public health emergency and offers a variety of resources. And I want to take a moment to highlight some of those resources. Governor Eric Holcomb and his staff, the Indiana State Department of Health, along with many state departments in the Unemployment Division, FSSA, and also with Dr. Moore and his team at the Grant County Health Department, all have Hoosier lives and wellness at their utmost priority. They are working daily to determine the most effective avenues that Commissioner Bardsley was talking about, and the phases. We all want to get us back to work. They want us to be close to our loved ones again, but we have to do that while continuing to ensure that we're going to keep Hoosier lives safe and healthy. You can visit the website at indiana.gov to review all of the governor's executive orders. And I also encourage you to watch his press conferences 2:30 daily at Governor Eric Holcomb's Facebook page, or at the Indiana State Department of Health Facebook page as well. They're very informative, and so many questions that you have and I have each week are addressed in his daily press conference at 2:30. I want to thank Commissioner Bardsley for explaining that phasing in of how do we get back to our normal. It's very, very important that we keep our Hoosier lives healthy and safe. Another additional resource that we have is the Indiana State Department of Health. They have regular updates at in.gov, coronavirus, and it's such a wealth of information. I go there very often. It gives you all the updated data, but it also gives you links and resources that you may need, and I encourage you to go check that website out too. If your employment has been interrupted or even ended due to COVID-19, you can file for unemployment benefits, and I encourage you to do that. Applications must be filled out electronically at unemployment.in.gov. And our small businesses and medium businesses and all of those businesses that have yet to be added to those opened orders and essential businesses, my heart is with you. We truly are understanding the plight and the angst that you guys are going through. And my office at the State Department are here to help guide you through that, those trying times. A couple of options that I have been given to give to you is a 4-year loan through the Federal Main Street Lending Program, which you can find at thefederalreserve.gov to learn more. I know that federally, officials and legislators are working really hard to expand and implement in a timely, efficient, and effective and accessible manner the PPP, Paycheck Protection Program, through the Small Business Association. I encourage you to continue to work with your banks, your loan officers to evaluate the PPP program. The latest guidance on PPP can be found at sba.gov. And also in our community, a statewide map for nearby food pantries or meal sites are available at in.gov/FSSA. I also, on a local level, want to let everyone know that the Grant County Economic Growth Council and I believe the Chamber of Commerce at grantcounty.com has an excellent page with resources for COVID, for food pantries, and also for those for businesses. And United Way will be here later, and Marion Community Schools, I know the school systems are there, so please be sure to check out those websites. And finally and lastly, I want all of our residents to know about 211. Anybody can dial 211. It's our Indiana 211 is a free service that truly helps connect our resources with our community members and our family and friends. It's very quick and confidential, but they can get you to some of these resources that we talked about today. And lastly, I just want to say, as your state representative, my office at the State House, my legislative staff are here for you, for my friends, my family, my neighbors, and all of my district. It is very, very confusing. There's so much information coming at you, from unemployment to tax changes, to tax deadline changes, to resources that are available. And I know that it's confusing, and sometimes the websites are not as easily friendly and having some glitches in them, but call my office. I'm here to help. I'm here to be your voice, and so is my staff at the State House. So feel free to call me and let me help you navigate through these issues. My number is 317-234-9499, or you can email me at h31@iga.in.gov. And I just want to say, go back to that phrase that we've been really inspiring in Grant County, is that we are all in this together and that you are not alone. We hear you, we know you. I'm so appreciative of our Grant County team. They have amazed me, from Grant County EMA to Dr. Moore and his office at the state, to the county commissioners, city councils, and Marion General Hospital and the extended care facilities. I'm so impressed with the leadership and the love, and every meeting that I've ever been a part of, all of you are front and center in their minds and in their hearts and trying to do the best for Grant County. So with that, I say thank you for an amazing team, and God bless you, and stay safe and healthy. Thank you.
Thank you, Representative Vermilion. And next we are going to be joined by Dr. Brad Lindsay, Superintendent of Marion Community Schools.
I want to thank Sunnycrest Baptist Church for this opportunity to share. I want to thank you for your mission of bringing the truth, the love, and the light, always, and especially during this time. This evil pandemic is hitting closer and closer to home. I don't know about you, but you know if it's hit a family member, or you know if it's hit a loved one. Early this morning, I got a message from a dear friend here locally, whose 21-year-old daughter had been tested positively, and my dear friend was tested here this morning. It's hitting close to home. It's serious business. So let me share from my heart. It's important that we come together and we choose to align to authority and purpose. And the reason is for clarity. And it's for energy alignment. I don't know about you, but I can't afford any wasted energy. I want to go right to the voice of truth. So I'm asking you to please listen to the voice of truth. For me, that's the Word of God transmitted through the Holy Spirit. That's for me. We all make our choices, but the Word of God is a voice of truth. I'm asking you to please listen here today as you're tuned in here today. Listen locally. Our public health officials, they're providing right information, the voice of truth. Dr. Moore is delivering with courage the voice of truth. He's being transparent. Why? To help us. We can't afford wasted energy. Amber Turner from Public Health, her nurse, voice of truth. Bob Jackson, emergency management. He's been a hero. Voice of truth. Mark Bosley, you just heard from. Voice of truth. So please listen to that. In education, our governor's speaking daily. And he's doing a tremendous job. And he's working with our state superintendent, Jennifer McCormick. And our Department of Education is providing excellent leadership for us in schools during this time. They're doing a fantastic job. Our State Superintendents Association and superintendents from across the state and principals across the state, we are thinking and communicating daily. Locally, all of our schools, we're working together. We will meet again on Friday for a check-in. The superintendents in all the schools and principals and teachers in Grant County love and care for your children. That's why we are here, and we care for the families. And so we're working local. We're looking together. Please check with your local school on their website. Please stay connected with your teachers and social workers and principals. Let's stay connected, and we'll stay connected with you because we need each other. In Marion Community Schools, in the last 5 weeks, we have distributed over 160,000 meals to families. We love the opportunity that we can serve. Again, tonight, 4 o'clock to 6 o'clock, we expect to distribute over 35,000 meals. Thank you, community, for your help in getting them out to our families. It takes a team effort. Thank you for being respectful and considerate and kind and patient. It really helps us. Here at Marion Community Schools, you can get on our websites, and again, talking with your teachers, social workers, principals for online resources to keep that learning growing at home. But also next Monday, if you'd like to be part of our home packet distribution for the paper pencil, come by next Monday, and again, there's more information on our website. I'm going to ask you, let's please keep loving and caring for one another. Let's be respectful and considerate. When this hits so close to home, to people that we love, let's don't waste around with wasted energy, because life is too precious. And let's don't waste a moment not loving and caring for one another and being respectful and being considerate and being kind. For me, I'm going to put this mask back on. I love you guys. And as we come together as a community, we've said before, individually we're all valuable, but we're all vulnerable. But when we come together tight as a fist, we are ready for battle. And this is a battle. This is a war against an evil virus. But when we come together and we fight in this community, we win. So community, let's fight. And let's trust in God to provide the victory. Thank you.
Thank you, Dr. Lindsay. Next, we will be joined by United Way CEO Alicia Hazelwood. Welcome.
Thank you. My name is Alicia Hazelwood, and I'm the Executive Director for the United Way of Grant County. I'm here to talk to you today about what you can do to make a difference here in our community. Many of us have been inside, we've been in our homes, we've been social distancing, but we all have a need and a desire to feel connected and to feel like we're helping and making a difference in our community. And even in a time like this, we can still continue to do that. There's lots of ways to get involved. You can call the United Way of Grant County at 765-662-9811, and we have have plenty of ways for you to engage, volunteer in a safe way, and to give back to our community. There's resources. If you are in need of something, call 211. Go to 211.org and find the resources that you need. A lot of our organizations help every day, regardless of whether COVID or Corona or the flu or what's going on. They're helping families be stronger and have the things they need to get by every day. And those same organizations have stepped up in this environment to try and make a difference. And so the easiest way to help them as they're losing revenue while having to give out even more in resources is simply to send some finances, send cash. We love getting donations of products. We love in-kind products. But right now there's a lot of concern about what could be on that gallon of milk that you donate to the food pantry. And so really, if we allow those agencies to take our financial resources and maximize them for the benefit of our greater community, that's the best thing we can do. And so the easiest way to give is to contact the United Way or our community foundation. Both organizations have funds available that you can contribute to that agencies all across Grant County can receive funding from. You can also find resources at connectgrantcounty.org, and again, just simply calling our office. Right now as well, we want to make sure that you know some of the biggest needs in our community are food. They're personal care items, and they're just simple appreciations that you can do. We're also collecting homemade cloth masks. Marion General Hospital is in need of those. We have a lot of employers and essential workers that are in need of those. So if you're at home and you're kind of crafty, go to cdc.gov and find out how to make a cloth mask with ties so that it fits more individuals, and we'll make sure to help you get those to the people in need in our community. And we just want you to know that we're here for you, whether it's today, whether it's tomorrow. United Way of Grant County has been in the community since 1929, and we're going to continue to be in the community to support you. So if you're in need of something, or you have something that you want to give or offer an assistance, do not hesitate to call. We know that some people in our community don't have access to internet, don't have access to computer, so please pick up the phone and call us at 662-9811, and we'll get you connected to the resources or volunteer opportunities that you may need. Thank you so much, and stay strong.
Thank you, Alicia. And again, for anybody that wanted to write that down, the website she referenced is connectgrantcounty.org. That's connectgrantcounty.org. And next we will hear from Sarah Evans of Marion General Hospital.
Thank you. I'm Sarah Evans with Marion General Hospital, and today I just want to provide a few updates regarding testing and some things that have been going on in our organization. To date, Marion General Hospital has collected approximately 700 specimens for COVID-19 testing. Of those tests, less than 14% have resulted in a positive result for the virus, and we are pleased that we are continuing to see test results be available within 2 to 3 days of that specimen being collected. Now, that is just for specimens collected at our organization. That does not represent all testing in the county. Those statistics are available through the local health department. We do want to thank those who have expressed interest in participating in our local blood drives. The community blood drive with Marion General Hospital, Meyer, and the South Bend Medical Foundation, which is scheduled for Monday, April 27th, is completely booked. So we thank you for that. We also want to inform you of another opportunity to help donate, and that will be on Thursday, May 14th, from 10 a.m. to 2:30 p.m., and this will be located in the parking lot just across from the hospital at our 330 building location. And those, to be able to donate, you can go to givebloodnow.com, and that is through South Bend Medical Foundation, and you can sign up for a time. You can also look for that information available on our MGH Facebook page as well. We are, as previously mentioned, continuing to accept cloth mask donations. If you are able to make those and contribute to the organization, that would be greatly appreciated. At this time, we have upped the masking rules at our facility in accordance with the CDC recommendations that anyone entering our facility have at minimum a cloth mask on at all times. So we are experiencing a need for additional masks, and those can be donated directly at the hospital Monday through Friday, 8 to 5 at our main entrance, or in conjunction with United Way or Community Foundation. There is a recommended pattern on the CDC website that you can look for to get guidance on how to make those masks. And lastly, on behalf of Marion General Hospital, its leadership, physicians, and staff, we want to express our sincere appreciation of the kindness, support, and donations that have been extended to Marion General Hospital. This has truly been a time in which we have seen the community come together, and we greatly appreciate everyone and their support. And we just want to continue to assure you that we are here to meet your medical needs as we face COVID-19 and beyond, and we appreciate you and your patronage of our services. Thank you.
Thank you, Sarah. And sharing with us next will be Dr. David Moore from the Grant County Health Department. Welcome, Doctor.
Thank you, Teresa, and it's my pleasure to be here with you today. Dr. Lindsay showed you his, and this is mine, and off camera, we are all protecting ourselves and being aware of the need for social distancing, and it's my pleasure to be with you here again today. I have been Grant County Health Officer for only a short time, but with this pandemic that's come along, I've been so impressed and so pleased with the team and the community that has come together to deal with the issue. It is a pandemic. It's a once-in-a-lifetime, once-in-a-century kind of event that is happening to us, and how we have prepared for it, how we've been ready to deal with it, to help and with plans to take care of it. The numbers are continuing to climb. There was a point in which we did not have it in Grant County. Then we had only one and just a few. We're now 100 in number with 5 deaths. And this may or may not be the peak. They're going to continue to go. They're here in our community. What we're wanting to do is to minimize it occurring, to slow the curve, to flatten the curve so that it can occur, and to deal with it as it does occur. We were concentrating testing initially on those who were most critical because of the shortage. Now that that is being relieved, we're looking to test more and more. As President Trump has mentioned, as we begin to try to move out of this phase, and I know you're getting tired of being stuck in the house and social distance and everything else that has been so important to getting us here. But as we begin to move out of this, part of that phase is going to be much more extensive testing and knowing where it is, and our ability, if we do see a surge in cases, to be able to test rapidly. And the Grant County Health Department, along with Marion General and along with many others, are getting to a point where we're looking to see how can we extend that testing to the community, and doing all that we can to make you and the community safe. We talked about the fact that we have it in our nursing homes. One nursing home in particular has been hit by, we knew that this was occurring, that this would occur as we look at what went on in the rest of the nation. And here we have a facility where unfortunately it probably came from the community, and there's going to be our testing to try to find out where it is. But once it was in there and started, about how responsibly the nursing home has responded to that, and to have the spokesman from that facility come and talk to us now, we're going to present Aaron.
Good afternoon. Thanks, David, for having us here. On behalf of TLC Management and Colonial Oaks Health and Rehab, I'd like to thank everybody for allowing us to speak on behalf of the COVID-19 positive cases that were confirmed at Colonial Oaks. My name is Aaron Grindstaff. I'm the Regional Director of Operations for TLC Management. And since the first confirmation of the positive case at Colonial Oaks, I was assigned as the healthcare administrator to lead the team of professionals there through this event. I've been honored and humbled to lead such an amazing team there that have responded, as Dr. Moore said, responsibly. And at this behalf, I'd like to give an update here. We decided to take an aggressive and a proactive approach with widespread testing once we had the first case of COVID-19. As of today, we have 33 total residents that were tested positive, and as I mentioned, we tested 100% of our residents. We currently have 29 in-house residents, and unfortunately, we have lost 3 residents to this virus. So we have 1 resident that we did send to the hospital. My understanding, they are doing well, and they are anticipated to return. We have 27 staff members that ultimately tested positive, and we were able to test 100% of our staff. Now, the good news is that the majority of these individuals, both residents and staff, remain asymptomatic and are doing well, and that is the light at the end of the tunnel in this scenario. Every one of the residents has been isolated and contained to the secure area that we had prepared in advance for this pandemic, just for this scenario. So fortunately, all the residents are isolated, and the staff working on that unit continue to work day and night on that unit, leaving through a separate entrance and mitigating the spread throughout the facility. I'm happy to report we continue to have plenty of personal protective equipment. We have no shortages there, and through our other healthcare communities and our own, we have been fortunate to be able to have adequate staffing and been able to continue to provide care and love for those residents that reside there at Colonial Oaks. It's important to note that we've had daily communication with both the county and the state health department. We have had on-site visits by the Indiana State Department of Health surveyor, and they work in conjunction with our team. They've been able to be supportive, continue to mention that they have extreme confidence in our mitigation plan, and have expressed not only their confidence, but their support in continuing to help us fight this. Also, we've had our medical team led by Dr. Srikanth on site daily, monitoring those residents both with symptoms, those that have tested positive and those that have tested negative. We have an amazing clinical team led by Jamie Sevier, and there's no better team to continue to lead the fight there. This has been an unprecedented challenge for our industry, our community, and for Colonial Oaks Health and Rehab. I can tell you there's no better team that was prepared for this event. Unfortunately, they took those necessary preparations prior to, and that's helped us to contain and limit this unprecedented event. I'd like to thank the community for the abundance and the outpouring of love and support, on-site prayer in the parking lots, the outpouring of food that's been provided for our staff, multiple agencies and companies that are providing donated masks and protective equipment. I would like to thank Dr. David Moore in the Grant County Health Department and the partnership with them, Marion General Hospital, Dr. Srikanth and his team, TLC Management. Also, the multitude of families of our residents and the support that they've given us that's needed through this event. So, lastly, if you would like to help, you can visit Colonial Oaks Health and Rehab's Facebook page for the opportunity. You can provide gift cards or meal donations that help to feed our staff while they continue to work through this event. We will prevail through this, and fortunately, once we've identified these residents, we've continued to have no further cases. So it's one by one, we will heal these residents and we will get back to normal life. Thank you.
Thank you, Aaron. And I also would like to say thank you to Mr. Steve Wright, who is now the Executive Director of the local YMCA, for helping to coordinate today's efforts. I also want to say thank you to our local media, WBAT, the Chronicle Tribune, the News Herald, and many other local media outlets that are helping to share this information. Today's broadcast will be re-aired at 5:30 p.m. and again at 10:30 p.m. here on WSOT TV, and then it will be rebroadcast additionally on Sunday, April the 26th at 10 a.m. and again at 5:30 p.m. I'm Angela Stepp. Thanks for watching. We now return to our regularly scheduled programming.